In the heart of therapy lies a powerful force, often misunderstood and feared resistance. Resistance is not the enemy of progress. It is a signpost, a guide. It signals that something important is stirring beneath the surface, something that needs our attention. Rather than viewing resistance as an obstacle to overcome, we can embrace it as an opportunity for growth and self-discovery. This video explores the nature of resistance in therapy, its various forms, and the transformative potential it holds when we learn to listen to its whispers. Imagine a patient arriving late for their session, week after week. On the surface, this might appear disrespectful or disengaged. However, beneath this behavior lies a story waiting to be told. Perhaps the patient fears intimacy, or maybe they harbor unconscious anger towards the therapist. By exploring the resistance, we unlock a deeper understanding of the patient's inner world. This understanding is crucial for lasting change. Resistance is not a sign of weakness. It is a natural human response to perceived threats. When we feel vulnerable, our instincts tell us to protect ourselves. This is especially true in therapy, where we are asked to confront our deepest fears and insecurities. By understanding the protective function of resistance, we can approach it with compassion and curiosity. This allows us to create a safe space for exploration and growth. Resistance can be subtle, often disguised as something else entirely. It whispers in the silences, hides in humor, and reveals itself in forgotten appointments. Recognizing resistance is the first step towards understanding its message. Therapists and patients alike must be attuned to its subtle cues. One of the most common signs of resistance is avoidance. This can manifest as lateness, missed sessions, or changing the subject when difficult emotions arise. The patient may intellectualize their problems, keeping the conversation at a safe distance. They might minimize their struggles or claim they are fine, when their body language suggests otherwise. Another telltale sign is engaging in behaviors that sabotage the therapeutic process. This might involve starting arguments with the therapist, refusing to complete homework assignments, or repeatedly returning to unhealthy coping mechanisms. The patient may even appear to make progress initially, only to regress back to old patterns. Recognizing these signs is crucial for therapists. By acknowledging the resistance, we can begin to explore its underlying causes. This requires empathy, patience, and a willingness to sit with discomfort. The goal is not to force the patient to comply, but rather to understand the fear that fuels their resistance. Resistance is not a one-size-fits-all phenomenon. It wears many masks, adapting to the unique personality and experiences of each individual. Understanding the different forms resistance can take is essential for effective therapy. Some patients express resistance overtly, through direct confrontation or refusal. They may openly challenge the therapist's interpretations, dismiss the value of therapy altogether, or become argumentative and defensive. This type of resistance, while challenging, can also be an opportunity for direct engagement. It allows us to address the patient's concerns head-on and build a stronger therapeutic alliance. Others exhibit resistance more covertly through subtle behaviors that undermine the therapeutic process. They may engage in excessive storytelling, intellectualization, or humor to avoid confronting painful emotions. Some patients develop psychosomatic symptoms, experiencing physical discomfort as a way of expressing their emotional distress. These forms of resistance can be more difficult to identify and address, requiring careful observation and interpretation. To illustrate the complexities of resistance, let's consider a few case examples. Sarah, a young woman struggling with anxiety, consistently arrived late to her sessions. When confronted, she would apologize profusely, blaming traffic or work deadlines. However, as therapy progressed, it became clear that her lateness was a way of maintaining control and avoiding intimacy. By arriving late, she could dictate the pace of therapy and avoid revealing too much too soon. John, a middle-aged executive, presented with symptoms of depression. He was initially resistant to discussing his emotions, preferring to intellectualize his problems and focus on solutions. He would often steer the conversation towards work, minimizing his emotional struggles. Through careful exploration, it emerged that John equated vulnerability with weakness, a belief rooted in his childhood experiences. His resistance stemmed from a deep-seated fear of judgment and shame. These examples highlight the diverse ways resistance can manifest in therapy. It's important to remember that each patient's resistance is unique and serves a purpose. By approaching resistance with curiosity and compassion, we can create a safe space for exploration and growth. At its core, resistance is a defense mechanism, a way of protecting ourselves from perceived threats. These threats may be real or imagined, conscious or unconscious. Understanding the underlying motivations behind resistance is crucial for transforming it into a catalyst for growth. One of the most common drivers of resistance is fear. Therapy requires us to confront uncomfortable truths about ourselves, our relationships, and our place in the world. This can be a daunting prospect, evoking fears of judgment, rejection, or even annihilation. We may resist out of fear of what we might discover, afraid of the pain we might unearth. Shame also plays a significant role in resistance. Many of us carry deep-seated beliefs about our own unworthiness or lovability. These beliefs can be so ingrained that we are not even consciously aware of them. When therapy threatens to expose these core wounds, we may resist to protect ourselves from further shame and humiliation. Resistance is not always about avoiding pain. Sometimes it's about clinging to the familiar, even if it's no longer serving us. Change can be scary, even when it's positive change. We may resist out of a fear of the unknown, a reluctance to let go of old patterns, even if they are causing us suffering. Navigating resistance is a delicate dance, requiring both empathy and gentle confrontation. The therapist must create a safe and supportive environment where the patient feels seen, heard, and understood. This involves active listening, validation of the patient's experience, and a non-judgmental stance. However, empathy alone is not enough. The therapist must also be willing to challenge the patient's defenses and encourage them to move beyond their comfort zone. This requires a balance of support and challenge, tailored to the individual's needs and readiness. The therapist's role is not to force change, but rather to illuminate the patient's own internal resistance and empower them to make different choices. One effective approach is to explore the resistance directly, inviting the patient to reflect on their behavior and its underlying motivations. This can be done through gentle questioning, such as, "I notice you often arrive late for our sessions. I'm curious about what might be happening for you around that." The goal is not to shame or blame, but to foster self-awareness and understanding. The therapist can also help the patient reframe their resistance as an opportunity for growth. By acknowledging the protective function of resistance, we can begin to view it as a signpost, guiding us towards areas that need attention. This shift in perspective can be incredibly empowering for patients, helping them to see their resistance as a source of strength rather than weakness. The process of transforming resistance into insight is a collaborative one. It requires a strong therapeutic alliance built on trust, respect, and a shared commitment to growth. Both therapist and patient must be willing to lean into the discomfort, to sit with the uncertainty, and to remain curious about what lies beneath the surface. One powerful tool for working with resistance is reflection. By encouraging the patient to observe their own thoughts, feelings, and behaviors, we can help them gain a deeper understanding of their own internal processes. This can involve journaling, mindfulness exercises, or simply taking a few moments to pause and reflect during the therapy session. Another important aspect of this process is identifying and challenging unhelpful thought patterns. Resistance is often fueled by negative self-talk, limiting beliefs and distorted perceptions. By bringing these thoughts to light and examining their validity, we can begin to dismantle the barriers to growth. The therapist can also help the patient develop healthier coping mechanisms for dealing with difficult emotions. This might involve teaching relaxation techniques, encouraging creative expression, or exploring alternative ways of communicating needs and boundaries. The goal is to empower the patient with the tools they need to manage their emotions effectively and navigate life's challenges with greater resilience. Embracing resistance requires a willingness to embrace the struggle. It means accepting that growth is not always linear or comfortable. There will be setbacks, moments of doubt, and times when we want to retreat back into the familiar. However, it is in these moments of discomfort that true transformation occurs. Think of a muscle being stretched. It's uncomfortable, even painful at times. But it's through this process of pushing beyond our limits that we build strength and flexibility. Similarly, in therapy, it's by leaning into the resistance, by facing our fears and insecurities, that we develop greater emotional resilience and self-awareness. The therapist's role is to hold space for this struggle, to provide support and encouragement, but also to challenge the patient to keep moving forward. It's about finding the balance between pushing too hard and not pushing enough. The goal is to create a space where the patient feels safe enough to take risks, to experiment with new ways of being, and to ultimately break free from the limitations of their past. Embracing the struggle also means celebrating small victories along the way. Every step taken towards confronting resistance, every moment of vulnerability, every act of self-compassion is a victory worth acknowledging. By celebrating these small wins, we reinforce the patient's progress and motivate them to keep moving forward on their journey of growth. Resistance, far from being a roadblock, can serve as a valuable roadmap in therapy. It highlights our ingrained patterns, our deepest fears, and our unconscious desires. By paying attention to where resistance arises, we gain invaluable insights into the workings of our own minds. For example, a patient who consistently avoids discussing their childhood might be harboring unresolved trauma or pain. A patient who intellectualizes their emotions might be struggling with vulnerability or a fear of intimacy. By exploring these patterns of resistance, we can uncover the root causes of our suffering and begin to heal old wounds. The therapist's role is to help the patient decipher the messages encoded within their resistance. This requires careful observation, active listening, and a willingness to ask probing questions. It's about connecting the dots, identifying recurring themes, and helping the patient understand the underlying motivations behind their behavior. Uncovering these hidden patterns can be a profoundly liberating experience. It allows us to break free from the chains of our past and make conscious choices about who we want to be in the present. By understanding our patterns of resistance, we gain the power to change them and create a more fulfilling and authentic life. When we embrace resistance, we transform it from an obstacle to an opportunity. It becomes a catalyst for growth, a springboard for self-discovery, and a testament to our resilience. By leaning into the discomfort, we unlock a depth of understanding and healing that would not be possible otherwise. The process of working through resistance can be challenging, but the rewards are immeasurable. As we confront our fears and insecurities, we develop greater self-awareness, emotional maturity, and compassion for ourselves and others. We learn to navigate difficult emotions with more grace and resilience, and we build stronger, more fulfilling relationships. Resistance is not a sign of weakness. It's a sign that we are alive, that we are capable of growth, and that we are worthy of love and belonging. It's a reminder that we are all a work in progress, and that the journey of healing and self-discovery is ongoing. The beauty of embracing resistance lies in the realization that we are not defined by our past wounds or our ingrained patterns. We have the power to choose differently, to create new narratives, and to live more authentically in the present moment. By embracing resistance, we step into our power and claim our birthright to a life filled with meaning, purpose, and joy. Overcoming resistance is not about conquering it, but about befriending it. It's about recognizing it as a part of ourselves, a messenger from our unconscious guiding us towards wholeness. This journey of self-discovery requires courage, compassion, and an unwavering belief in our own capacity for growth. It's important to remember that overcoming resistance is not a linear process. There will be ups and downs, moments of progress, and moments of regression. The key is to approach the journey with patience, self-compassion, and a willingness to learn from our mistakes. One of the most valuable lessons we learn on this journey is the importance of self-care. Confronting our resistance can be emotionally draining, and it's crucial to prioritize our well-being throughout the process. This might involve engaging in activities that bring us joy, seeking support from loved ones, or simply allowing ourselves time and space to rest and recharge. Overcoming resistance is not about achieving perfection, but about embracing our imperfections. It's about accepting ourselves fully, with all our flaws and vulnerabilities. It's about recognizing that our struggles do not define us. They are simply a part of our unique human experience. In conclusion, resistance, often perceived as an adversary in therapy, is actually a powerful ally in disguise. By understanding its various forms, Recognizing its underlying motivations and learning to work with it constructively, we can unlock its transformative potential. Embracing resistance is not about eliminating it, but about befriending it, learning from it, and allowing it to guide us towards a richer, more authentic life. The journey of therapy is rarely easy, but it is always worthwhile. By embracing the struggle, leaning into the discomfort, and trusting in the process, we emerge stronger, wiser, and more connected to ourselves and the world around us. Resistance, in its many forms, becomes not a barrier to overcome, but a stepping stone on the path to healing, growth, and self-discovery.